Hello everyone, good day. It is Princess Cassandra Pimentel, a nursing student of National University, Philippines. And for today's video, I am going to demonstrate the three different techniques on how to apply topical medication properly. So first, let's talk about the topical medication itself. So the administration of topical medication over a localized area of the body allows the absorption of the drugs through the skin, mucous membrane, and tissue membranes. So, a topical medication can be formulated as a cream, lotion, ointment, powder, foam, spray, and transdermal patch.
So, the first thing that we should do is check the medication administration record through the provider's order. So, we should check the MAR twice, like this. Okay. And after entering the room and providing privacy, introduce yourself to the patient. Hi ma'am, good morning. I am Princess Cassandra and I am your nurse for today. And after that, identify the patient through or by using two identifiers. Hi ma'am, may I know your name please?
Jewish Pascal,
Can you please tell me your date of birth?
November 16, 2009.
Okay. So another option for clarification of patient's identification is by checking their wristband. So your Juris Pasqua, date of birth is November 16, 2009. And you might as well ask the patient if she had an allergies. So ma'am, can I ask you something? Do you have any allergies or anything to be worried about?
None po.
Okay, good. After clarification, do the third check on the MAR and also check the medication date of the expiration. And as you proceed, keep in mind the 5 rights of the medication administration. So let's get started then. So before applying one of the topical medication, make sure to perform hand hygiene first and put some personal protective equipment if needed. So in this case, I've already done hand washing, put some surgical gloves on, and wears face mask as well. And then, make sure to apply clean gloves. Much better if you use the sterile one, especially if the patient's skin is not intact. This practice prevents the spread of any diseases from the patient to the nurse or from the nurse to the patient. So, to use a topical cream, ointment, or oil-based lotion, first, what we should do is clean and dry the area. So what we're going to do is use some water to wet this cloth and gently dab it on the patient's skin. And after that, we're going to dry it using this dry cloth. So that's it. And after cleaning the affected area, change the gloves and put it in a proper waste disposal bin or something. So now I've already put on some new sterile hand gloves. So we should proceed to the next step by placing a required amount of the medication in the palm of your hand and warm it by briskly rubbing your hands together like this. And to apply a topical cream, make sure to spread the medication evenly over the patient's skin. So what are we going to do is use a long strokes in the direction of the hair growth. Remember remember to not rub the skin in a rush way. And also, don't forget to mention that, ma'am, your skin may feel a little bit greasy for a while. Is that okay?
Yes.
And that's it. Then, remove the gloves. After that, let's move on and proceed to the next technique. So, to apply a suspension-based lotion, clean and dry the area. So what we're going to do is use some water to wet this cloth and gently dab it on the patient's skin. And after that, we're going to dry it using this dry cloth. So that's it. And after cleaning the affected area, change the gloves and put it in a proper waste disposal bin or something.
Then, let's move on and proceed to the next procedure or to the next step. To the next technique. So, to apply a suspension-based lotion, what we're going to do is shake the container first, vigorously.
Then, place a small amount of lotion on a gauze dressing or a cotton pad. In this case, I'm gonna use a gauze dressing. So after that, we're going to apply the medication on the patient's skin. Tap it gently to the patient's affected area of the skin. Also, don't forget to mention that, ma'am, this might feel a little cold when I apply it to you. Is that okay? Okay. Then, gently dab the affected area. It might take for a while for it to dry, okay? So, you should remember not to rub the affected area vigorously to avoid the damage on the patient's skin. So, just dab it gently. And after doing the procedure, we're going to take off the gloves out of our hand. So, this is how we do it, and put it on a garbage bin or somewhere else that is far away from the patient. So, I already put some sterile gloves again, and for this last technique, I am going to demonstrate regarding the administration of the powdered medication. So first, we're going to ensure that the surface of the affected area is thoroughly dry. So first we're going to clean it. So using this wet cloth, dump it on the patient's skin, then spread any folds of the skin such as between the toes, like this, or maybe or under the axilla. After doing that, dry those areas with a towel. And after doing the procedure, we're going to take off the gloves. And after cleaning the affected area of the skin, make sure that the application site should be covered with a fine, thin layer of powder. Then cover the skin using your gloved hands, or you can use also the gauze dressing, cotton pads, or whatever under a instruction of the health provider. And that's it. However, if you're applying powder near the face, nose, or mouth, ask the patient first to turn away for a moment. Then, sprinkle some powder on the gloved hands and apply it to the area of the patient's skin. So, by doing this practice, it may prevent the inhalation of the powdered medication.
And that's it.
After the procedure, make sure that the patient understands the procedure itself. So, ma'am, I am hoping that you understand the importance of this procedure and the procedure itself. So, if you need me or anything, or if there's anything that I can do, just call me. I will be here after 1 hour. Is that okay with you? Okay. So, after that, perform hand hygiene. Document that the medication was given, including the site of application and any significant observation on the client's response, and the evaluation on the nursing intervention as well.